This is Chanel Bunger with the Becker Private Equity and Business Podcast. And today I have the pleasure of speaking with Mary Inman, partner at Whistleblower Partners LLP, who joins us today to share some insights into her background, trends she's watching, and a bit more. Mary, thank you so much for joining me today. Could you please take a moment to introduce yourself and tell us a bit about your background and organization?
Sure. Thank you so much, Chanel. It's great to be on the podcast. I'm a big Becker's fan, regular reader and listener. So I am a whistleblower lawyer, which is a strange breed of lawyer for folks who don't know what that means. I'll just try and unpack it a little bit. So for the past 28 years, I've specialized exclusively in helping whistleblowers bring information to government agencies who pay them for that information. So I think for most Becker's listeners, they'll be familiar with the False Claims Act. Under the False Claims Act, which is a civil fraud statute, it empowers whistleblowers to launch lawsuits in the name of the government if they have information that government programs are being defrauded or funds are being misappropriated. So again, in the healthcare space, that's often Medicare fraud, Medicaid fraud, upcoding, and a number of other different practices. So my specialization is helping whistleblowers launch False Claims Act cases alleging healthcare fraud. And in exchange for undertaking the risk to speak up, those whistleblowers are paid a financial incentive or reward in the form of usually between 15 and 25% of any recovery the government makes. So I'm a bit of a matchmaker. I match whistleblowers with information with the agencies who want to pay them for that information in the government.
Love to hear it. Thank you so much for that introduction. Now, moving forward, what trends are you watching in the whistleblower space currently?
Well, one of the trends I'm watching is a rise in what we're seeing in the types of whistleblowers bringing information to the government. So I think most people are familiar when you think about a whistleblower, folks are going to think about the classic, quintessential, prototypical whistleblower insider. Someone who works at the company and is privy to information about wrongdoing. That whistleblower typically brings that information to the employer's attention, tries to get it corrected, and if it isn't corrected, then they typically resort to bringing it to the government. The trend I'm watching is the rise in a type of whistleblower that we have dubbed whistleblower outsiders. So these are outsiders who are folks who have observed the fraud as outsiders looking in. So a couple of the trends I'm watching is that Sanofi Aventis, which is the global behemoth pharmaceutical company, they themselves are typically the targets of whistleblower cases, of False Claims Act cases. They have turned the tables and actually brought a whistleblower case successfully against one of their competitors, Mylan. So they didn't work at Mylan, of course. They actually observed the type of fraud, which in this case involved the misclassification of EpiPens to try and avoid paying rebates to Medicaid. They observed that because a customer of Sanofi's reported Mylan appeared to be undercutting Sanofi's pricing and paying smaller rebates than Mylan did. So that was a trend we saw evolve and a successful case that kind of really shocked a lot of us. We were really surprised to see a corporate becoming a whistleblower when we're typically seeing individuals who are insiders, employees of the target company. So that was interesting. But why I'm saying it's a trend I'm watching now is Allstate Insurance recently did the same thing, took a page from Sanofi's book, and also became a plaintiff, a whistleblower plaintiff in a False Claims Act case. That case recently survived a motion to dismiss. Allstate brought the case against a toxicology lab for billing the government for medically unnecessary urinary drug tests. And how Allstate came to learn about the fraud is they were a victim of the fraud and had their own commercial litigation against the toxicology lab. And it was in the context of that they became privy to information like the state of mind of the decision makers, things like that, through the discovery process. And they then creatively decided to become a whistleblower. So the trend that is new and maybe interesting to listeners is that you don't have to be an individual, a disgruntled former employee to be a whistleblower. Now it looks like big corporates are doing it too.
Got it. Now you've walked us through the trends that you're watching, but what are you most focused on and excited about currently?
Yeah, so what I'm focused on right now is a very new development, which is that the Justice Department on August 1st launched a brand new whistleblower reward program, one that they've dubbed the DOJ Corporate Whistleblower Awards Pilot Program. And the reason I'm focused on it is it's really remarkable to see DOJ coming up with a brand new program on their own. The False Claims Act has been around since the Civil War, and DOJ has been using that device. And so it's just interesting to see DOJ branching out and bringing their own tip program. So under the False Claims Act, whistleblowers can launch lawsuits in the name of the government. But here, under the new DOJ program, they're soliciting tips. This is something from the whistleblower. So the whistleblower, they don't have to launch a lawsuit. They can just submit tips to the government. And if the DOJ acts on it, they can receive a reward. So DOJ is really taking a page out of the SEC's book after Dodd-Frank, Wall Street reform, and the financial crisis. The SEC adopted a tip line and created an office of the whistleblower soliciting tips from whistleblowers. The CFTC has one, the IRS, now the Treasury Department has one for sanctions violations and money laundering. So it's really intriguing to see DOJ criminal here deciding that they don't want to miss out on this opportunity. They want to get tips from whistleblowers too. So how it impacts healthcare is that they have recognized that the reason they wanted to bring the program into existence is they noticed, the DOJ noticed, and Lisa Monaco said that the existing whistleblower reward program, she described them and equated them to a patchwork quilt that doesn't cover the whole bed. So her program is trying to fill some of the gaps left by existing whistleblower tip programs. And so as it relates to healthcare, DOJ is now soliciting information, tips from whistleblowers about healthcare frauds that are focused on private health insurance companies that are being defrauded, or where patients and even investors, which I know is of interest to private equity, if they are the target, if they are the victims. So it's a really new development. We're focused on it. It's only a week old. And it'll be interesting to see what the government does in this space.
Mm-hmm. So, looking back over the past 6 to 18 months or so, what initiative are you most proud of, would you say?
In terms of what I'm proud of in the last 6 to 18 months, I have a little bit of a breaking news piece, which is that I have spent the past, I think it's close to 12, 15 years working on a type of whistleblower case that has become, in essence, an industry-wide practice, an industry-wide fraud. It's in the Medicare Advantage space, and it's known as risk adjustment fraud. We've had a number of successful cases in this space. And what has happened recently is that we've achieved a settlement with Independent Health, which is a health insurer in upstate New York. I'm not able to divulge much more about it other than that we've reached a settlement. This case has been going on, initiated by a lovely whistleblower by the name of Teresa Ross. And the case involves allegations of risk adjustment fraud, which, to unpack it, means basically upcoding of diagnosis codes, because under Part C of Medicare, as listeners know, you don't get paid based on the number of procedures. You get paid a rate based on actuarial data per member per month. And so here, the allegations involve making patients look sicker than they are in order to increase that rate. So it's with great excitement and pride that we have finally appeared to have resolved that case with the defendants, and should have a settlement forthcoming to be announced more publicly.
Oh, exciting stuff. Well, Mary, I want to thank you for your time today. But before I let you go, I have one more question for you. With all of your experience, what advice would you give to evolving leaders?
Yes, I love that question. My advice to evolving leaders, not surprisingly, is to really help leaders to debunk the myth that whistleblowers are disloyal and are people that they're disloyal and people you don't want in your organization. And I say that's a myth because there's lots of data that suggests, and certainly my experience working with whistleblowers has borne out that whistleblowers can be among your most loyal employees. They're the folks who have the temerity to speak up and tell you when something's wrong as a way to advise you. They're like an early warning system, a great risk detection system. So I would challenge evolving leaders to try and resist the training that we have as children to think about snitches as disloyal and instead to embrace some of the social behavioral science that's now showing that companies who listen to whistleblowers are actually more profitable than their peers who ignore them or retaliate against them because they're able to use that information to course correct. So whistleblowers can be a CEO's best friend, and that's what I would encourage leaders to think about.
Absolutely. Well, Mary, I want to thank you once again for your time today and for joining me on the Becker Private Equity and Business Podcast. It was a pleasure. Thank you so much.
Likewise, thanks so much, Janelle. Appreciate it.